Integrative cancer care is looking at adding in complementary or integrative therapies alongside the radiation, chemotherapy, and other traditional treatments. Now, this can be during the treatments or after completing those treatments and looking at managing side effects and helping with quality of life. And we're really looking at research to help guide our approach. We're not just using any therapies. So there is a really big emphasis on safety and making sure we're not using therapies that interact. And I do often see patients that are on certain supplements or taking something that has the potential to interact either with their treatments that they're on or the cancer itself. So when I'm creating a plan for a patient, I'm looking at research trials that have actually used the therapy I'm considering for the cancer that the patient is experiencing, and in the same context, with the same medications and the same treatments. Oftentimes, you can find studies that do that, and really the context is very similar, so we can feel a little safe about their results and what we can expect. So one example might be cisplatin. There's a number of studies that have looked at natural therapies that can be used alongside of cisplatin and shown to help with the side effects that people experience. Some of the side effects that cisplatin causes are so severe that the dose has to be reduced. So if we can help a patient feel more comfortable by using a combination of therapies, sometimes that dose can be maintained and the full effect of the cisplatin can be obtained. Probably the most significant therapy we have is mistletoe injections. And that has over 150 different clinical studies that have been done. It's been used for about 100 years as well. The majority of patients in Germany, for example, with cancer are on mistletoe therapy. We just haven't quite adopted it here as quickly in North America. Studies have shown that mistletoe works in a couple of different ways. The first is mistletoe itself does appear to have its own anti-cancer impact and kill off cancer cells. The second is that it seems to enhance the immunity, and specifically it seems to strengthen the part of the immunity that is responsible for killing off cancer cells and foreign cells. Our largest studies on mistletoe have shown that it helps with nausea, vomiting, diarrhea, appetite loss, and pain, as well as energy levels. I often find that a lot of my patients just feel a better overall sense of well-being and feel more energetic, and that's one of the main reasons they would take it. Anyways, I won't get too much into the mistletoe therapy because I'm going to cover that in a separate video. There's so much I could talk on here, but and there's dozens of therapies I would consider in cancer care, but maybe I'll just jump real quick into some of the assessments we do. One part of the assessment is looking at the overall nutritional status. There's certain factors that affect say, for example, after surgery, how quickly a person heals. There's factors that affect the rates of complications. There was a study that was done in 2020 and found that people who maintained a proper amount of protein actually had a 40% reduced risk of complications after surgery. So there's a number of tests we can do to look at factors that help with healing, such as iron, serum albumin, and then look at the overall inflammation, and there's lots we could get into there. But I hope if you have any questions, just reach out, and I'm happy to answer.